I'm an orthopedic surgeon. I do a lot of surgeries. Here in this area, the hospital that is closest to us became a trauma center recently. And although I always did lots of fractures, we do even more fractures. And so we put a lot of people together that were in car accidents. We fix broken hips, broken femurs, broken arms, broken shoulders, broken ankles. So all kinds of things like that. And then electively, we do a lot of reconstruction surgery. I do a lot of hip replacement surgeries. That's probably one of my #1 surgeries. And I do knee replacement surgeries as well. And also do shoulder surgeries, rotator cuff repairs, and a lot of knee arthroscopy, besides all the fractures that I discussed. I also do a little bit of spine work. There's been a lot of advancements, mostly with pain control around the time of surgery. A lot of times now we're doing what we call regional anesthesia, so people are getting spinal anesthesia, and they're basically getting very light generals, and so they're not going to sleep as much, and it's much easier to recover from. We also have better perioperative or pain control. The pain control that we treat you around the surgery is better. We do blocks a lot of times before surgery, and people will sometimes have a block before the surgery, and that helps with post-operative pain control. We also do different types of things to help decrease blood loss. We give certain types of drugs to help decrease the amount of blood that you lose during hip and knee surgeries to make transfusions much less common nowadays. In addition, the joints that we do, some of the joints are a little bit newer. The plastics that we use last longer, and so we think that that's a lot better than it was 15 or 20 years ago. People hear a lot of different things, and so they sort of want to know the truth, because a lot of stuff that people hear is urban myth, and a lot of it's not necessarily true. That we have lots of different things that help with pain control, especially if you're having problems with your knee and problems with your hip. A lot of people have a lot of difficulty walking and walking far distances, and they can't enjoy their children and their grandchildren anymore because they can't walk. And so I wouldn't put off the things that you like to do, because there's lots of ways that we can sort of get you back on your feet in reasonable fashions. Part of the way people do well after surgery is that we have to pick the good candidates for surgery. If you're not a very good candidate for surgery in the first place, then you're not going to have a very good outcome. So we try to be careful on who we pick, and if people are not healthy enough, if people smoke, that's one contraindication to surgery. So we really try to get people not to smoke, people that have uncontrolled diabetes. So those are some of the things that we like to make sure that is under control before we do surgery.